Today we're here having the Stanford Trauma Survivors Reunion. We started this event 5 or 6 years ago, and there were really a couple of reasons for doing this. One was many of these patients need to tell their story. They've dealt with physical injuries in the rehabilitation and bringing themselves through that, but some of them still have a lot of emotional issues and the need to share their story and to bring some closure into it. It's also a great day for the staff and the physicians who help take care of these people to see them months down the line. So it's a huge morale boost for the staff to be able to see these patients doing well, but it's also an emotional closure for the patients to be able to come and tell their stories.
I was in a horrific car accident, Christmas Eve 2002. Well, when I entered Stanford, I had a severely crushed right leg, a brain injury, serious brain injury. My kidneys and liver failed. My lung collapsed. I had to learn how to walk again. I had to learn how to talk again. I had to learn how to play the guitar again.
Thank God we have this facility available, that we have this level of expertise available. The whole trauma team is amazing. They're stellar. They're professionals to the 10th power. And again, if it wasn't for the Stanford trauma team, my son never would have survived.
My daughter was hit by a car in August of '06. We were in a crosswalk. She was holding my hand, and suddenly I saw headlights and then heard the car, and when I went to get her out of the way, she wasn't there. And she had been hit by the car and flew 100 feet, and thank goodness she's okay.
I remember fully the incident, the moment when I was hit by the car, and the first thing I said was, "Take me to Stanford. I want to go to Stanford." I can tell you this, that I came in such condition that my son, who is a cardiologist, and my internist, who were both in the emergency room when I was brought in, both thought that I wouldn't make it. And from that point on, here you see me, I'm standing, I'm walking, I'm talking, I'm thinking.
They're wonderful. The doctors, nurses, staff are just wonderful people who are just so open and honest and just really care about the kids and families.
Trauma surgeons are faced with a lot of adversity in providing care to patients. And I think the bottom line is that trauma surgeons do this because it helps people, it's constructive. And this sort of event where you get to learn a little bit more about the personal side of patients validates what you've been doing. And it's really the most wonderful form of gratitude. There are other trauma centers around the Bay Area, but I would venture to say that Stanford Hospital is the premier trauma center in the Bay Area, and we're here for the people of the peninsula and the people of the Bay Area.